Yeah, nowadays I will tell you that the neuroscience in Africa, we have some improvement on the number of the neurosurgeon, the neurologist. We have improvements, not like in 1990,
Yeah.
20 years ago, we have an improvement, So nowadays it's possible to have one neurosurgeon, for 1 million
Wow.
inhabitants in some area in Africa. But before, sometimes you can see a country do not have any any neurosurgeon, sorry, but the gap is to have what the WHO recommend is to have at least one neurosurgeon for 100,000 people. That is the wish of everyone
Every
every
society.
country, society.
Yeah.
So we have also a gap to
To feel.
we are working to close to this gap, but a lot of effort
Yeah.
is still to be done to close this gap.
Hello.
Hi.
How are you?
I'm fine. I'm fine. I hope you too.
Yeah, I'm good. Wow.
Great.
Man,
Nice.
how's Morocco?
It's not bad. It is a little bit hot, but it is okay. It is about 23 degrees or 24 degrees.
Oh, that's good.
Yeah.
The UK,
Yeah, it's not bad now.
yeah, the UK is in the 30s, I think.
Oh my
Yeah,
God.
yeah,
So,
yeah.
it's so hot then.
As I'm talking to you, I have the fan pointing directly to me.
Okay.
Mm-hmm.
I guess.
Wow.
Okay.
Yeah, thank you for being here. I've been for some time. I've been looking for one guest who live in Northern Africa, and two, I have been also looking for doctors, especially neuroscience, because that's something I got interested in after my incident, and I've been doing some more reading in that area, to understand the brain, and then that drove me to consciousness, and right now it's one of my favorite subjects. I like to read about, Anyway, Dr. Bankole, please introduce yourself to my audience. Tell them who you are and what you do.
Thank you very much, Jerry. Pleasure is mine this evening, and I'm grateful that you invite me, you host me for podcast. I hope you hear me very well.
Yeah, I can hear you.
Great. So I am Dr. Nuruddin Bankole. Originate from Benin Republic in West Africa. I have 31 years old, and I did my medical school in Senegal, in West Africa, also Dakar, Saint Christopher Medical College of Medicine in Dakar. And after 8 years, I applied for the World Federation of Neurosurgical Societies foundation scholarship that I will be granted, and I come here in Morocco in the WFM Rabat Training Center to do my training in neurosurgery. So recently, I was recently graduated officially neurosurgeon last month ago.
Congratulations.
Thank you very much. So right now I am officially neurosurgeon, consultant neurosurgeon, and I love so much neuroscience since I started my medical school. I know that I would like to become a one-day neurosurgeon because of a lack of neurosurgeon in my community in West Africa. So that motivates me so much to become a neurosurgeon. So
very,
thank
very
you very
good,
much
very good.
to ask me.
See, many of my audience, and I suspect many of our people know about doctors. Okay, we all have visited doctors over the years, but very few would have met a neuroscientist or a neurosurgeon. Okay, unless they fall victim to disease of the brain. I never ever met a neuroscientist or doctor until I fell ill. Okay, so tell my audience about neuroscience, neuromedicine, neurosurgery. Okay, just enlighten us.
Great. Neuroscience is very, it is global word to that include neurologists, neurorehabilitation, neuroanatomopathology, neuropsychology, neurosurgery. That include inside, that is the neuroscience. The neuroscience is the science of everything about the nerves, the brain, the spinal cord, the nerve, the central nervous system, and as well the peripheral nervous system. Everything that can cure this part of our body who control everything in our body. So all this science that we usually say, we usually call that neuroscience.
Yes.
Especially my field as neurosurgery, it is a discipline that cure, surgically, as well medically, but most surgically, the disease of the brain, the nerves, the spinal cord, that is we call neurosurgery. And also the neurosurgery, you have a lot of part of neurosurgery. You have neurotrauma, you have neurovascular surgery, you have neuro-oncology, you have pediatric neurosurgery. You have how can I say that? Also have school-based surgery. So it is a very big one. Discipline. But the goals it is to cure, a disease about the nervous system, central, as well brain and spinal cord.
Interesting.
So it is little bit big and tricky.
It's big. It's the brain and the
spine,
central nervous system controls everything about
everything.
us. Everything.
Also the spine. Also, don't forget also the spine.
Yes.
Because neurosurgeons nowadays. It also take care about the spine, as discal herniation can compress the root of the nerve, can give sciatica, So the spine also as well the spinal cord. So nowadays the surgeon take care about all these things. Also the trauma, the spine trauma also we take care also about that.
Yeah. See, you mentioned that what enticed you to go in this direction was that you discovered that your community, and I suspect all of our community, do not have specialists in neuroscience or neuromedicine. Tell us about that. What is the state of our communities when it comes to neuroscience, neuromedicine?
Yeah, nowadays I will tell you that the neuroscience in Africa, we have some improvement on the number of the neurosurgeon, the neurologist. We have improvements, not like in 1990.
Yeah.
20 years ago, we have an improvement, So nowadays it's possible to have one neurosurgeon, for 1 million
Wow.
inhabitants in some area in Africa. But before, sometimes you can see a country do not have any neurosurgeon, sorry. And nowadays, we improve, but the gap is to have what the WHO recommend is to have at least one neurosurgeon for 100,000 people. That is the wish of everyone,
every society,
every country, society.
Yeah.
So we have also a gap to
fill.
We are working to close to this gap, but a lot of effort is still to be done to close this gap. So yeah, it's very difficult to see that you have just a simple example like trauma, brain trauma. And you have like a epidural hematoma, and you can be safe because if nothing is done, and if your epidural hematoma after traumatic brain injury, nothing was done, you can lose your life and never recover. But imagine the country that no neurosurgeon. Is
that?
It is a disaster, It is a disaster, And so, in my opinion, I think that every country should work on this field to encourage neuroscience because everything around neurology, neurosurgery, neurorehabilitation, all these things concurred for also for the economic, because without to have all your cognitive function working well, you cannot do anything. And also, if your brain stops to work, even if you have a good heart, you have a good lung, a good bladder, everything, but if your brain's going off, all these organs,
everything done,
also going down and will stop to work.
Yeah.
So that is why it is very important, to try to encourage people to do this specialty, because general medical, the doctor who do general medicine, he will be able to diagnose this disease.
Yes.
But he cannot be able to treat them accurately like a specialist.
Yes.
That is the difference. So we need to have more specialists in our country, everywhere in Africa. We need to work hard for that.
Yeah.
And also our government should help or should give, should give enthusiasm, should be enthusiasm to bring back the specialists abroad, to their home country to avoid brain drain, the brain. Brain drain.
It's very important. It's very important. Yes.
Yeah. So we need specialists in our area. So we have to work on this field to have more specialists in our country. Africa is not just about malaria. Africa is not just about give a birth.
Exactly. Yeah.
So we have the same problem regarding the real disease like the high-income country also. It is just because it is misdiagnosed. That's why we think we don't have this disease in our country. No, but it is wrong.
Yeah. Tell my audience the kind of neuro diseases that are everywhere, okay? Because there are so many different neuro problems that people can have. So tell us, what kind of problems do you have?
Yeah, we have a lot of disease in I will take just my field about neurosurgery, and maybe I will talk a little bit about neurology, But
okay.
In my field, we have neurotraumatic disease, neurotraumatic problem, TBI, trauma brain injury.
Yeah.
Benign, moderate, and severe. We have this disease that is very one of the first public health problem in Africa. We have that, and except a neurotrauma, TBI, spinal cord injury also due to traumatism, due to the trauma also, the etiology is multiple. You can see fraud, assault, or road traffic accident, all those things. I will not come in these details. That's the neurotrauma. It can happen in adults as well as the infant and the children, And we have also the problem of the neuro-oncologic disease also. Many people have the tumor on their brain, but they do not know, especially in the children. We can see children who is just doing a vomit, headache, he become apathic. They will bring the children to the doctor. He will give him a drug because he eats something not good.
Yeah.
And at the terms, it's just because he have a tumor in
the brain.
In the brain. So
wow.
Don't hesitate when you have sometimes a recurrence of vomit, headache on the children. Please be aware. Try to see a neurosurgeon, on neuropediatric. Try to do on brain imagery, CT scan or MRI. Try to do it. That is about the neuro, and also. As well in adult, when you have headache, always headache, you take painkillers, is not going on. Please don't neglect that. Go to see a neurologist or neurosurgeon. Go to see to check well if it's not on signs of intracranial hypertension due to some new formation in your brain. In the brain, and as well in Africa we can have also tuberculoma. We have also this in endemic zone in Africa. We can have as well also infectious pathology that can infect also the brain and the spine, and the spinal cord also. So you have to be aware about that also, and every time that someone have a wound after trauma brain injury on the head, we should also try to think about the infectious, like a collected suppuration inside the brain. So you have to be attention about those, because that need sometimes emergency to be treated, to be diagnosed and to be treated. The most important thing that I will talk to you, because I cannot go all in the details about the neurology, the disease that we encounter in our field. It is also to be aware about the stroke, because nowadays you have a stroke, you have ischemic stroke, you have also hemorrhagic stroke, and we have most important things. It is also the subarachnoid hemorrhage that many people treat just like a simple headache, but it's not a simple headache. Subarachnoid hemorrhage is devastating, because if it is due of the rupture of the intracranial aneurysm, it is a big problem, because that's correlated with a high rate mortality if nothing's done. Normally, when you have subarachnoid hemorrhage, due to the rupture of aneurysm, you should be treated within the first 48 hours. At least 72 hours, you should be treated to secure this aneurysm who is ruptured and give you an subarachnoid hemorrhage, because the risk of rupture, the recurrence of rupture is correlated with more than 90% of death. You know?
Yeah.
So we should. That is the important thing that you know when you have some some ictal headache, suddenly a headache that you never feel before.
Yeah.
Please be careful.
Rush to
Don't
the
hesitate
hospital.
to go
Yeah.
hospital to try to do a CT scan.
Yeah.
And as well, we have some malformation also on the children, like spina bifida. We have malformation of cervical, occipital cervical, how can I call that? The Chiari malformation. We have this malformation as well in children, but the most of them is on children for the spina bifida due to sometimes we correlate that with the deficit on the folate in the mom who have deaf. So nowadays the policy should very be aware about that and systematically give folate to all young women who should give a birth on the first trimester and second trimester.
Yeah.
So and we have a lot of type of pathology. I don't know how can I say all of that, but tumor, infectious, vascular disease, and also sometimes we can have also degenerative disease like a Parkinson.
Yeah.
Like and sometimes a dyskinesia. Nowadays, a treatment exists for that. And so you can have also a metastasis in the brain, also in the spine, So all these things nowadays is possible, to treat them. And what is very important, what is the news is nowadays, it is possible also to treat people, to operate people, in the awake, that was my dissertation to become neurosurgeon. It is awake craniotomy. It is possible to make people awake, to do the brain mapping, to preserve the cognitive function, everything, and to remove safely tumors.
That's great. That's great. So you can be doing you can be doing surgery, and you be asking your patient if he feels something, if they can move.
Exactly, to do some tests,
to make sure it's working. Yeah, so that you don't take away. Yeah, very, very good. Very good.
Not just a problem of old adults. Also, the young adults also we are exposed about the stroke. I think we talk about that in this moment.
Yeah.
But we should take care about the stroke, whether ischemic or hemorrhage.
Yeah. So Nuruddin, I see, like I told you. I had a stroke about nearly now. Oh, this month, 11 years ago. Okay. It will be 11 years in a few less than 2 weeks. Okay.
Okay.
Now, since then, I've heard about so many young people of African descent, both here, and I have some stroke survivors who I mentor. I'm taking them through the hurdles, So I also see a lot of stroke survivors in Africa, but I noticed that we in Africa, especially Nigeria, my home country, so many young people suddenly fall and die. Okay. Now, that can be heart failure, but I think many of them might be a stroke. Okay. So that's why it's important, because I know how difficult it is to survive a stroke and then regain your functions. Okay. Now, for me, I struggled to speak for 4 years. Even now, as I'm talking to you, I'm gauging the words I use because there are still a lot of words I can't pronounce. Okay, a lot of words I can't even use.
Yeah.
Okay, because my tongue can't, you know.
Yeah, I understand.
So I want you to tell my audience a little bit more about a stroke, the symptoms, the effects, the rehabilitation, and other things about it, because I think it's something maybe prevalent in our society more than it should. Okay, and maybe also tell them some things they can do or to help them avoid having a stroke.
Okay. Thank you very much. As you say, nowadays as well, a young people also fall for stroke.
Yeah.
It is no more a disease of old adult and population, and we should be aware about the stroke, because that's what I want to tell you is that nowadays, and a lot of study has been done. If you go to the literature, the scientific literature, of course, the global disease reported lastly in 2019, something like 12.2 million incident case of stroke globally.
Wow. In a year.
And
wow.
101 million prevalent case of stroke. Within the last decade, the two last decades, sorry, the prevalence was more than 101 million, prevalent around the world.
Yeah.
Around the world. And the stroke was also the third leading, the level 3 cause of death and disability.
Yeah, I'm still. I can see. You can see. I don't use my right hand. People don't know that.
Yeah. Exactly. Exactly. And that is a disaster. So we might remain that stroke remain the second largest cause, okay, of the death nowadays. So we should be aware about that and to prevent that. Sometimes maybe we could not prevent that in the case that it is a hemorrhagic stroke, because sometimes hemorrhagic stroke sometimes revealed some problem in the brain, like because sometimes you can have aneurysm, you don't know, you know it's congenital, you don't know, okay? Yeah. Maybe some factor can allow us to have that, maybe family story, maybe some malformation, of Ehlers-Danlos malformation, some malformation can lead them to have a pathology of our arteries.
Yeah.
Then we might be, most affected by this disease. So and also sometimes some tumors in the brain sometimes could bleed in the brain and mimicking a stroke, a stroke. So we might do a CT scan in this case. And so when you have like, a dizziness, a headache, or I don't know, you have suddenly, your body who could not move, you cannot talk, you feel yourself not good. At the first hour, at the first moment that you feel that, you should not waste your time and searching about what's going on around me. No, please go immediately to hospital. Nowadays, I will talk about the centers because in Africa we are so, we are not in this step yet, and that is my fight, that is my my dream one day is to be able, when someone does stroke in my country, like Benin Republic, in your home country, Nigeria, these people can be saved.
Yeah.
Because the most important thing that we should be aware about it is that the handicap will cost more than the treatment.
Yeah.
Because because if you treat, you will have someone with a very less disability or no disability.
Yeah.
You will. So I think nowadays it's important to to do a large awareness, in the population in our home country in Africa, that the stroke, it is not just about old people, it's also about young people, and everyone who do that, don't waste your time, go to the hospital immediately, because within the 4 hours to the beginning of the signs of stroke, you can be saved by thrombolysis. And if you have if you have a chance and you are in the good center, if the thrombolysis don't work, you can do also a thrombectomy. If you see on my background of my video, you will see some stent with clot inside. That is a stent who retrieve a clot inside the vessel,
in the brain,
in the brain. That's to recanalize the artery who was, obstructed, And if the artery is obstructed, the brain did not receive the blood as the flow that he wants. So you're gonna have a stroke, So that's it, acute ischemic stroke, But when you have hemorrhagic stroke, it is depend also about the age, the volume of the hematoma and the brain, why he bleed, the malformation, who bleed, vascular malformation, or many etiologies should be done. Maybe sometimes it's about the angiopathy, amyloid angiopathy, because sometimes genetically we can have these amyloid problems, but nobody knows, So you can have also a stroke. And the most factor risk about that, it is the high blood pressure.
Yeah.
The high blood pressure nowadays, it is a disaster, whenever for the young population, of the old population. Nowadays, you can have just, 35 years.
So what are the causes of high blood pressure?
It is an hypertension, arterial hypertension. So it is. I'm not cardiologist, but it is a big problem that we have now. Everyone is can be faced of that. So we should pay attention about what we are eating.
Yeah.
So salty, so spicy, so how can I say that? All this fast food, all these things, a lot of gases, materials, oil, all this is concurred, to concur to dyslipidemia. And dyslipidemia, it is one of the risk factors that cause, a stroke, obesity, unhealthy activity, so it's very important to know that we have to pay attention about what we are eating, what we are doing. And stroke, it's not just about old people, it is about
anyone can have
it can be ischemic, it can be hemorrhagic.
Yeah. Wow. So Nuruddin, what do you envision, in your space of neurosurgery, neuroscience in Africa in the next 30 years?
Well, I would like, with all my heart, to be able to come back to my home country, to implement, a awake craniotomy, to implement the thrombectomy, to save life of people from stroke, because it's possible nowadays. A stroke is not mean that you should be handicapped, you should not be able to use your, no, it is possible to recovery free to your paralysis if the things done in the right time with the right times, you know, it's possible. So that my wish, it is the one day in Africa we don't need, you know, to always we should go abroad to go to treat ourselves. No, we should be able to treat ourselves in our home country, in our own city. It is possible, it can be possible to the president of my country to be treated in my country with him, you know, because just an example, can you imagine the president of France take a flight to go to USA to say, I want to go to treat myself because I have a stroke, I have something in my brain? It will be a disaster, you know. So I think my wish is in the 20 years to be able to treat everything regarding, you know, neuroscience pathology in each African or country. Maybe in the regional, you know, that maybe one city near, it's possible to come. It's better to go
specialists,
abroad, you know, because
special hospitals are
exactly. That is my goals, and I'm working on that, and I hope to become an hybrid neurosurgeon. That means I can operate, you know, and open the head, and also I can operate without open the head.
Okay.
That is the most important things that I would like also to implement in the 20 years in my home country.
Very good. Very good. Thank you, Dr. Nuruddin Bankole. Thank you very much.
Pleasure was mine.
Thank you very much. Yeah. Thank you. Bye-bye.
You're welcome. Bye-bye. See you soon.
Yeah.